that the reason why you have anxiety or depression is simply because you're not eating the correct foods. Depression is diagnosed simply like this. If it lasts to the point where there's no pleasure, where there's a lack of interest, you don't feel like doing it, you're exhausted, I don't feel like doing this anymore, I can't even think about it, I don't want to get up, lost your job, you ain't got no friends, you know, it's just you isolate yourself. If that happens for longer than 2 whole weeks, longer than to 5 weeks, then you're considered to be depressed with a major condition. Clinically, we're supposed to come out on the other end. We it's not like it's just the same as a diagnosis when it comes to a person who got diabetes. We're supposed to come out the other end because you can fix all these different things. Depression is not a lifelong disease. People got to get that out of their mind and thinking that this is not a lifelong disease. So you can't be like, wake yourself up, you know, come out of it, you know, pull yourself together. You can't think like that. It's people that think that depression is not real. It's real. I've been through this thing. I've been through it myself, trying to just being an introvert all the time, sitting back just studying and reading and just, you know, being stuck in the same room. Being stuck in the same room will allow you to, that's all you're thinking about. So you need to come out here in nature, breathe in some good air, not the stale circulating air in your room, the air condition. Those things are chemicals, guys. Your environment is what makes us sick. We eat antibiotics and it kills off our gut flora. We eat the antibiotics from the cows and the milk and all those different things that we should not be eating. They make you depressed because inside of those fat cells are the toxins of that cow that ate the GMO corn that was sprayed with glyphosate. Glyphosate kills off all of your bacteria. It stops the conversion from shiitake pathway to the choline pathway. So no, you do not supposed to be eating those type of foods. Those foods are causing a leaky gut that can cause inflammation in the brain. Inflammation in the brain is going to cause adrenaline to rise, cortisol to rise. These are stress hormones that play a big role in those neurotransmitters. So what I'm saying is you have to choose the correct foods, which is simply fruits and veggies. Don't be, you know, eating a lot of wheats and rye and becoming gluten intolerant, and then that inhibits the amino acids from even making tryptophan. Eating meals, say a person starts fasting and he doesn't know that he's hyperglycemic or hypoglycemic. His blood sugar gets so low that his insulin rises, and now there's no way his gut flora can even produce the molecule of tryptophan. So he becomes depressed. He becomes depressed. There's a lot of different ways a person can become depressed. And to understand that it's all about what you put in your mouth. Like, a person does not have to go through schizophrenia. A person does not have to go through anxiety. It's depression or major depression. If he allows his gut to replenish every 3 days, which normally is supposed to happen if you don't drop a bomb in it with antibiotics. Antibiotics created from the meat that you're eating. Even if you're taking antibiotics or any type of pharmaceutical that allows your gut not to replenish, like antidepressants like Zoloft and Prozac. Welcome back to It's Herbal Time with your herbal chemist, Doc Shalom. As you know, depression is not a quick fix. Depression is one of those natural human psychiatric behaviors that we all go through when we're facing some type of adversity that happened in the past or something that is happening currently. We can all learn coping mechanisms to deal with these biochemical responses, but I'm not a psychologist. I'm not a psychiatrist either, but I am a herbal chemist, and there's a lot of reactions that are going on inside of our body based on what you put in your mouth. So I like to say your brain is your gut and your gut is your brain, but also food controls your mood. So if you pay attention to all of the natural responses that we're having, check the food that you're eating, because you could be creating a lot of depressive thoughts based on what you're eating. So in this next segment, I'm going to go over the nutritional needs of a person that's going through depression. The minerals, the vitamins, the herbs, the foods to avoid, and the foods that can help you stabilize and elevate your mood. Listen, we're not trying to go through hypermania, your highs and your lows of depression. We are trying to heal those who have non-clinical and clinical depression. So this is the time, vital information, people. Let's go find out how to do that in the class. If you are depressed and you don't have a sense of meaning and purpose to your life, you actually have no pleasure. So some of the psychological responses that I've shown right here, you guys also, I know you guys like my drawing right here. I used to be an artist, so I'm still an artist, but anyway, but these are some of the psychological responses. A person will put themselves in low self-esteem, low confidence, anhedonia. You guys can look this word up, but that's basically having no pleasure at all. There's no sense of value in life, or there's no pleasure in life. Anhedonia is some of the psychological. Then you put yourself in guilt, anger, and isolation. Now, there's many different causes that can cause these situations, especially suicidal thoughts. Some of the drugs actually cause some of these situations, but I've had people in my experience go through many different mental or brain issues, but one of them is most likely like postpartum. A lot of ladies go through, after having a child, feeling like a part of them is missing, so they'll go through this situation of postpartum depression. And I like to equivalent that to also as a heartbreak, because you're having a piece of someone, you're losing a piece of someone out of your life, and it feels like this attachment that has just went away. So that few periods or weeks that go by can really put you in a isolated, low self-esteem, no pleasure type of feeling. And so those psychological responses also has a lot to do with our physiological responses, which are things like when we're stressed out, or when we don't have the pleasure, or we don't reach a certain goal, or we fail something, we tend to have a low appetite. We tend to get very fatigued because of the low appetite, and without feeding our gut microbes, we tend to actually have insomnia too. So all three of these things actually happen whenever somebody's going through depression. Now, we may have went through some bad decisions. We may have, and it may not be even our fault, but I do like to kind of equivalent how the brain has to be in an equilibrium, like a synergy type of effect with the brain. So if you're going through these actually like major depression, you won't have concentration, you won't be able to function as you should as a normal happy member of society, I would say. And this person would not be able to work, so that makes it also expensive. The losing of quality of life makes your life expensive, because you can't go work and do the things that you need to do. So major depression is always an issue. It can become manic depression just by, I would say, a thin line can turn major depression into major depression based on certain medications, I would say. So I don't want always to think about some of the bad decisions. So some of the bad decisions may come during the moon phases. Now I have to throw this in there because the moon changes our mood. And I know the ladies also know this based on their cycle. If you're coming across the new moon, your cycle, actually your moods actually change, or you're coming across the full moon, a lot of people
deal with that moon cycle. So me personally, when my zodiac sign is in a certain moon phase, like the last period, what happened in the snow moon, there was a lot of emotional disturbances. There was a lot of psychological disturbances that caused me to maybe lose a slight loss of interest in certain things. So we got to pay attention to our behaviors during that moon cycle. I think that's very important, so we know ourselves, and the people that are around us can also recognize their actions, decisions during that time as well. So behaviors, our decisions, they are sometimes based on another example would be the people that end up in the hospital on the full moon. A lot of erratic behaviors happening in the streets. You'll see a lot of crazy things going on. So that should basically let you know that there are a lot of psychological things going on during the full moon. I also want to throw in this SAD, which is seasonal affective disorder. A seasonal affective disorder happens to a lot of people in the northern side of the country, where they don't see the sun for about 2 to 3 weeks during the winter months. So we know that sun really allows us to feel a happier feeling. The vitamin D penetrates the pituitary gland, and it allows some biochemical reactions with our cerebellum, with our cerebrum, and many different areas of our hippocampus. So that allows us to feel some type of serotonin and dopamine. That sun helps activate those neuronal type of hormones. So we do need the sun. It's very, very important. So people up north may want to consider moving down to Florida during those winter months, so that you can still be able to function properly, especially if you're facing things like depression or other mental or psychiatric behaviors. Now, I've had people with schizophrenia, I've had people with bipolarism, and I can always go back into the manual to see how they diagnose things, but usually it takes about 2 to 6 weeks to actually get a full diagnosis of someone that is actually going through those issues. Now, I'm going to be going over a lot of different things, guys. I'm going to be going over some of the biochemical process, and I'm also going to tell you about some herbs that are naturally help. I want you to know that depression is a temporary state of mind. Okay, so don't think that you have to make a permanent decision during a temporary state of mind. So you can always get over or come out on the other side when it comes to depression. So it's just some things that you have to do to actually reinvent yourself and overcome. So some of the drugs that they have already prescribed for people. Now, this is something that I do not want people to ever be on, but keep in mind that 1/4 of the women in America is actually on antidepressants. So that's a lot of people when there's billions of people here, 1/4 of that population. So a lot of times the first thing that they do is give them a SSRI, a serotonin, or a selective serotonin reuptake inhibitor. Now, a lot of you guys may know about these selective serotonin reuptake inhibitors. Basically, they want to inhibit the ability of serotonin being recycled. So there have other little drugs like that, but they want to actually reuptake that process. And I drew up here the presynaptic cell and the postsynaptic cell. So we see that the postsynaptic cell has receptors on it, and there is also a transporter. Circle this up here so you guys can know that there is a transporter enzyme right here that allows the serotonin to be taken across to get to those receptors. So that's the reuptake mechanism, but the drugs actually want to stop that from happening so that you can get more serotonin in this synaptic cleft. So this is the synaptic cleft, and they're going to use certain enzymes to actually inhibit that. And I want to draw up here so you'll see when this is actually inhibited, If a serotonin, if one of these selective serotonin reuptake drugs actually inhibits, then it's going to stop this process right here and allow a whole bunch of serotonin to join in this area. All right, I got to put this up here in a different color because we have basically took away the transfer enzymes so that we can get more serotonin in this area. So this is a monoamine neurotransmitter, which basically is serotonin. It was a double-blind study where they had done, gave a person probiotics before and after. And they gave them an MRI after they gave them antibiotics, and they seen that the flora had all been destroyed. But then they gave them probiotics in the form of yogurt, and I'm going to give you the particular yogurt that they did it on. It's actually called Bulgarian yogurt, because it has over 90 billion strands of probiotics in it. Bifidobacterium is the most one that it has in it, and they showed that their brain actually increased their white matter in their hippocampus. So that lets me know that those neuronal, those hippocampal cells that I wrote up here, they're starting to proliferate and grow. So bifidobacterium, yes, I do have, I have some lactobacillus up here. Lactobacillus is another probiotic, but this also has billions of strands, and it has some some actual bifidobacterium in here. But I just wanted to make sure that I have this here as a demonstration, so that you guys know that unpasteurized milk, guys, is very beneficial. The pasteurized milk is harmful. That is the strands that they have actually commercialized, and the whole milk that they have in the stores. That's the wrong type of stuff to get when it comes to those bacteriums are dead. But if you deal with the unpasteurized, like the Bulgarian yogurt, you'll get more of this, and you can heal your depression faster. So once we deal with the microbiota, you'll find that your sinuses will clear up, your tendinitis will go away, your vertigo will go away, a lot of different brain issues. Even Parkinson's has been shown when there's more bifidobacteria and lactobacillus in your system, those things start to correct themselves. Now, some of the other things that have this in it, now, like Faecalibacterium, you can get a lot of that from, let's see, you got turnip greens, we have collard greens, of course, all have this type of Faecalibacterium, Dialister type of bacteria. Those are all good bacteria that reduce the depression about 30%. Also, you got chickpeas. You can do chickpeas. Now, besides these things, you can always do, turkey gives you tryptophan, fish gives you tryptophan. So you guys that like salmon and want to really just stick with your plants and everything, that'll be a good way to do that. Now, another thing that can also do it is dark chocolate. I picked up some dark chocolate with cherries and berries in it because I think that if you do more berries have been shown to heal Alzheimer's. Like if you do more blueberries, this is dark chocolate covered cherries. You can do that because it also gives you tryptophan. So chocolate, the dark chocolate kind. All right. And blueberries is a phenol that helps your memories. So you can always do blueberries with this situation. Now, the bad bacteria, I don't want to say that they're always bad because they help level out or also balance out some of the other microbes. So it's things like Clostridium and Streptococcus. We hear about strep throat and we hear about candidiasis causing bad situations in the gut. But they also help balance out the other flora. So we got to have parts of Candida. We got to have parts of Clostridium in our system. So I like to see that you have more of these over here than these, because we know the Streptococcus creates something in your respiratory tract, and strep throat is something that's very familiar. We don't want those bad microbes becoming more abundant. So herbs. How are we doing on time, people? Looking like we're doing pretty good. Now, I do have some herbs up here. I have some good herbs up here, like St. John's wort. I was going to make some St. John's wort tea, but for the local students, but they did not show up. We'll get a chance to do that another time. We also have pantothenic acid. Remember that it takes, in order to get this acetylation happening in the brain, to turn it into melatonin, you have to use B5. You also have to use B6 when it comes to the decarboxylation pathway. So these are important for the brain and also important for those bacteria. So you got to have these good vitamins in. So let me write those things down. So vitamin B6, B5, and I would say anybody that's going through withdrawal. So this is another part of the psychological response, like withdrawal. Say for instance, somebody wants to stop smoking. Know that nicotinic acid is vitamin B3. When you deplete vitamin B3, your cravings come back. All right, so those are the B vitamins you need for the brain. All right, so other things that you need. Now, you may hear a lot of people talk about DHEA, fish oils, omega-3. If you do not have enough omega-3, these synapses won't work. They will be so far apart and they won't be able to create a connection. So a lot of brain fog actually happens when you don't have omega-3. And you get that from mostly fish oils. Make sure that that fish oil is not rancid. I do take it myself. I take the omega-3s right here by Sogar. I sell these at the store. So you do need some type of omega-3. And some people would say, well, I get mine from some type of algae. I get it from making Irish moss gel. Know that light is the penetrator of all omega-3s, omega-6s. So once you get to that, remember I talked about fatty acids and sterols. Once you get to that fatty acid at number 3, it creates a perpendicular line, a parallel line, I would say, a parallel line. And when that happens, if the light penetrates that, it becomes rancid that fast. So sunlight should not ever hit your CMOS gel. Sunlight shouldn't hit it because you won't get any type of omega-3 out of it. All right, so some people talk about plankton and getting sea algae and different things. If it's dried and you try to make a gel out of it, it's going to be kind of hard to do getting those omega-3s. So I just take the fish oil, the omega-3s, and that makes it much easier so that I can have proper balance in those neurons and those synapses up here. So next thing, herbs. We talked about passion flower. Passion flower is really, really good. This can also help with melatonin process. It goes down that SAMe pathway we talked about when it comes to the methylation process. It handles most of the monoamine neurotransmitters. So we really get into serotonin and melatonin with passion flower. So you'll be able to sleep better. You'll you might even use that as a weight loss mechanism too, because it acts like a inhibitor. So keep in mind, when you're dealing with serotonin also is produced in the gut. So when you have something like a food poison that's going on, serotonin will alert the brain, saying to make you feel nauseous. Either you're gonna vomit fast or you're gonna have diarrhea. This regulates the gastrointestinal motility, meaning that if it comes from the gastrointestinal tract, it'll either open up the pyloric sphincter and come out of the esophageal sphincter and makes you vomit. It can actually do that, those type of food bugs, because that's where the serotonin is being produced. So serotonin makes you get rid of the bad food. All right, so and it also will create diarrhea if it's something bad, a bad bug that's in there. So you can use things that help regulate that. That's a very good mechanism to let you know that you're getting too much serotonin. All right. What were some other things? Some other things about the herbs. I have up here hops. Hops flowers also helps regulate the mood. Hops is also found in some beers. So that that's also a regulator, a mood regulator as well. But it helps with depression, and it helps with anxiety. It helps with sleep. So you'll see that I use hops in things that I want to kind of use as a way to make people go to sleep. It's in my total relaxation formula. Also, let's write down hops. Some other herbs that are really, really good for this situation. We said St. John's wort. Now I have to put a warning on St. John's wort, because if you are on different medications, say if you are on a beta blocker and St. John's wort will not do well together. That's a counter interaction. It can cause some heart palpitations, and you don't want to use St. John's worts with any other medications, because this is more like a antidepressant type of thing. St. John's wort should not be used with those at all. That's just a common knowledge to not use St. John's wort with it. Now, I do have my brain booster that actually increases the flow to the brain. We're using things like ginkgo. So ginkgo, you need proper blood flow to the brain. So even if you were to use things like beets will increase the vasodilation in those vessels in the brain. Cayenne, you have to increase the blood flow. So how would you create more neuronal pathways? Of course, having omega-3s and increasing the blood flow. All right, y'all people, I just dropped a bunch of gems off to you guys on that lecture just now. So I forgot to mention one particular study, and I've been trying this on myself, and it really, really works. It's called electroshock therapy, where you submerge yourself into a cold shower for about 5 minutes, and therefore all of those nerves can go send signals to your brain trying to overcome the coldness of that shower. And that changes your mood instantly. So I want you to try that method. It really, really works. But overall, I'm glad I got a chance to share this vital information with you guys. And I've decided that if you pre-register at Shalom Health Institute, I am offering a full semester on mental illnesses. And I know mental illness is not a choice, but these 8 classes will cover schizophrenia, bipolarism, autism, depression, and a lot of other things as well. Compulsive behaviors, those things that we really go through out there with our mental health. Let's find out the natural things that can help us heal. I see you guys on this herbal time next week. Blessings.